Good evening, everyone. Give us 1 minute and we'll get started. Thanks for being here.
Isabel, we have close to those we're expecting.
I think so. Let's see. We have a forum.
We do. We do have a quorum. I'm sorry, I didn't.
Yes, we do.
Okay. Okay. All right. So maybe we should get started. Welcome to our July meeting of the Community Engagement and Communications. So I think we're going to move right into tech check. Isabel can walk us through the tech check.
Yes. So thank you, everyone. Just a little bit of orientation to your Zoom settings. You have a couple different options on how to view the layout of little boxes. If you would like to adjust that, you click the view icon at the bottom of the screen. There are a number of different icons for committee members. You'll have the ability to unmute and turn your video on and off there. And for members of the public, that feature is turned off until we get to the public comment portion for people that have signed up in advance for that. And Spanish interpretation is available today. You can click the round icon labeled interpretation in that bottom menu bar and select either English or Spanish as the language you will be listening and speaking in. And with that, I think we can get going into a roll call, if that sounds good, Amy.
Yeah, let's move right into roll call and we'll
Great.
see who's joined us since we last checked.
Sounds good. Michelle Glass.
Present.
Amy Fellows.
Here.
Max Brown let us know that he will likely be unable to attend today. Mickey Dirting should be arriving a little bit later. Jocelyn Ogden.
Here.
Thank you. Colin Stackhouse.
Here.
Thank you. Juan Pablo Villalobos Garcia.
Here.
Thank you. Jensina Hawkins.
Here.
Jay Brown. I have not seen Jay yet. John Buzzard let us know that he won't be able to make it tonight. Craig Newton. Don't see Craig yet. Juana Yesenia Hernandez Solis.
Here.
Thank you. And Grace Holtkog. I don't see Grace yet. So that is our lineup for today.
Great, thank you. So yeah, today, just to go over our agenda quickly, we are going to have our Dr. McDonald give us our board and transition committee update. We're going to go over the focus group addendum review with the deaf and hard of hearing community that came later. And then we're going to go over the community input section of the draft report that is due to the legislature. We're going to hear from all of you if you have any updates or things to share. And then we'll roll into public comment and reflections and thoughts about next meeting topics. So Mimi, I think you're up first.
I am. Thank you. Good afternoon, everyone. I'm Mimi McDonald, Executive Director of the Universal Health Plan Governance Board. Thank you all so much for joining us on this afternoon here in July. So a couple of updates for those who are not aware. July 23rd is the final transition committee meeting. That is actually tomorrow. The transition committee has done a tremendous amount of work, especially in a couple of areas, really going deeply into the questions of administrative savings and a few, and also, of course, an actual transition planning. So I'm incredibly grateful to them. So if you want to tune in, that's happening tomorrow at 1 o'clock from 1 to 2:30. And again, just so much gratitude for the tremendous amount of work they have done. Let's see, in terms of the board, a couple of things. As you know, there will be some vacancies coming up for our board members, and a list of recommendations was for those board members is submitted from the governance board to the governor's office. They have a process that they go through with, of course, the governor's office making the final decisions. Those people, whoever is decided to fill the roles, we'll find out about that in September during legislative days or a little bit before. So we're so grateful for all the people who've applied. We have just really again, grateful people being on the committees and being willing to be a member of the board. So the board has had a couple of meetings since we saw you last on July 9th and also the 16th. I'm going to bury the lead and say that we talked about the draft report, information technology, and waivers. And then I will also say that the board has really doing their due diligence and have been working very hard on a revenue proposal, revenue model, and made the decision that they felt that the work that has been done to date on a revenue model is not ready for prime time. So they have made a decision that for a report to be submitted in September, on September 15th is when we're legislatively have been asked to provide a report. They did not feel that a revenue plan was sufficiently completed to be able to include that in the report. So just you may have heard that, and so just wanted to share that information. The work continues to go on that part of the report. So just so people know, it's not like we're just stopping, but just that was the decision. So I think that might be all I have right now. I think that's it for my slides. Unless you go on to another one and I said something else. Nope, not me. So I'm going to go on to, thank you so much. So focus group, I'll turn it back over to you, Amy.
Okay, great. Before we move on, are any questions for Mimi? Okay. So hopefully some of you have had time to review the focus group, and Isabel, if you could share the report just for people to read along or those that haven't to catch up, and maybe scroll up. So again, this is input from persons who are deaf and hard of hearing. It was a focus group that we were able to arrange a little bit later, working in partnership with Bridges, Oregon, which was a great organization to work with for this community. So the feedback is organized using the same categories as the main report that from March 2026. But we wanted to go through some specific things that came up in this particular focus group with you all. Maybe scroll up just a little bit more. So the possibilities is at the top of the screen, or yeah, we're at a page break. So in general, participants, identified potential benefits of having a universal health plan with a single system with one benefit package. One said providers could improve access and provide consistent care for everyone, and that they very much felt behavioral health coverage is a priority, that participants see it as a central to whole person care, which I think we've heard from other groups as well. If you want to move up to the next page. So there was a lot, as you would expect, around accessibility and communication accommodations that really need to be improved upon from our current system, including ASL interpreter access, video remote interpreting is frequently substituted, but has many complicated issues, if there's poor Wi-Fi, or leaving patients with no communication during certain moments. Individuals from the deafblind community require tactile interpreters, which is a very specialized group, which can cause a challenge in emergency medical situations because I don't think most health systems have those on staff. And yeah, so this is mainly about the interpretation. You want to move up a little bit more. Again, behavioral health being a large need, and finding ASL fluent therapists is extremely difficult. And insurers typically offer a sign language interpreter for sessions instead. Participants raise concerns about this approach. In a small community, the interpreter and patient are likely to know each other, which causes confidentiality issues. And dental and vision both felt strongly. And on the vision, if you go up to the next screen, I think it's really important for us that are not part of that community. Something that came up was that vision coverage is uniquely critical for persons who are deaf and hard of hearing, because it is the primary means of communication, navigation, and daily functioning when you don't have, and you're not able to hear. So that was a very important point about that group. Let's move up a little bit more. Acknowledging tensions between expensive and high cost treatments. And supplemental insurance. And move up a little bit more. Health literacy issues particular to this community. There's a model shared from Michigan where deaf and hard of hearing individuals are trained to deliver health education in ASL. So something Oregon may consider. And if you want to go up just a little bit more. For transition planning. Similar feedback, I think, to some of the other groups. Consideration about remote workers living in Oregon with out-of-state employers, and emphasizing that people who are deaf, blind, or hard of hearing have historically been excluded from engagement processes due to lack of communication access. Transition planning should proactively address this, and that was one of the reasons we definitely wanted to hear from this community. And then if you can scroll up so we can look at the suggested actions for the board. So these were the suggested actions: establishing a universal and enforced standard for communication access, addressing the video, I'm forgetting the R, but the video interpretation, which has a lot of issues currently, supporting ASL interpreter workforce, and considering the disproportionate impact of this community when making dental and vision benefit decisions. So I think that is the end of the report, and we can have a little discussion or thoughts or any surprises. Thank you, Michelle, video remote interpreting. Yeah, Michelle.
Thanks, Amy, for running us through a quick overview of this report. I just also wanted to publicly thank and share with the committee a little bit about the process for this work group. Staff worked very hard for months to make sure this work group could happen. Lots of coordination emails between the community organizations that were helping to facilitate this and helping with recruitment, and had a lot of other things on their plate as well that they were juggling. So just, I think, as well as Diana Bianco, our consultant, actually extended some of her timelines and, put together an extra report so that we could make sure that we heard from this really important community that will be impacted that is currently impacted by disparities within our system, and would be impacted and could stand to benefit if we're really thoughtful and listening from a universal system. So I just want to thank staff for the extra effort that went into making sure that this could happen, being flexible with timelines, and also Diana Bianco, I really feel like this is a moment where the board's commitment to centering health equity shown. And, we talk about how our definition is the redistribution of resources and power, and certainly allowing the community that's impacted to determine what timeline works for them when they have capacity, and aligning resources to support that so that we don't miss out on hearing from them because they can't meet kind of state arbitrarily set deadlines that the board is working towards. It meant a lot to me as a co-chair to see that equity commitment upheld at every level through staff, consultants, kind of through the whole process. And I think that this report is really important. I learned a lot reading it. So just wanted to also share that and thank the folks who made it happen. So thanks Mimi, thanks Isabel, thanks Lee, and thanks Diana. And Bridges, Oregon.
Yes, Bridges, Oregon. Yeah, thank you, Michelle. Are there other thoughts or comments people want to raise after reviewing this? Colin?
Yeah, I have a question on like the best way that the board can take these things into consideration, like that, for example, like the third, support the ASL interpreter workforce, consider investment strategies. My sort of memory is like from the rest of the focus groups, there's like probably like many considerations that are suggested by the many different people. And there's no way, oh, you've got a September, October, November, December, you've got 3 more months. Can we roll in some financial considerations for ASL interpretation strategies? That doesn't seem realistic, but like, what's the thought for the next steps for these considerations?
I don't know if you have thoughts on that, Amy, but I just want to remind the committee that the plan is not fully developed. It will not be fully developed in September. The work will continue and the workforce component will continue. So workforce considerations, especially aligning resources to support specific elements of the healthcare workforce, would be part of the transition planning and implementation work. So that is not all going to be complete by September or even laid out in the report. So I think that what's so critically important to me about these recommendations is that we keep them in front of us. And so I think one example is in our last board meeting in July, because we had received this report, there was a discussion about, should we consider not including dental and vision as part of the universal plan? And one of the things that this community recommended was consider the disparate impact, right, of not offering those benefits. And so that we were able to bring that into the discussion in the moment. And so I think that's exactly how I would expect the board to continue to use these types of recommendations, is when we're considering a decision that relates to these recommendations, that we incorporate them at those appropriate times. And some of them are, happening now, and some of them are going to be in later phases of the work, is how I would see it.
Yeah, and I would just add, like, on the interpreter workforce, currently the Oregon Health Authority Office of Equity and Inclusion has a program around interpreters and the interpreter workforce. And so maybe making a connection there and understanding what they're doing and what they're, given the funding situations and that we're all facing, what their plans are to continue to reinforce that workforce, not just for ASL, but other interpreters as well. So we can make connections with things that currently exist to continue to push for, making things better now while we are in a transition to, a universal health plan, hopefully in the future. So that'd be my other thought. Good question. Any other questions or comments before we move on to looking at the draft report, the community engagement section of the draft report?
Yeah, I would especially love to hear if anyone had anything that stood out to you that we didn't highlight when we walked through the report. Just would love any thoughts from the committee.
So should we transition to looking at the board report now, since we're not hearing any other
Sure. So if folks have input on the last agenda item on the addendum report, yeah, feel free to raise your hand and we can go back to that. But the other, so both of these items were on our agenda last month when we had the amazing presentation from Warren George. So we all agreed to table these discussions until July. And so this is coming to you now as kind of our first opportunity to discuss the addendum report and then also to walk through the community input section that Amy and I have drafted for the report to the legislature. And our goal was really to go back to April 2024 and capture quantitatively, like how many people, and also qualitatively, like what are the themes of all of the public comment that has come to the board in official monthly board meetings, as well as to all of the committees. So like I literally have a folder on my computer with like all of the submitted public comment and all of the excellent summaries that Isabel and previous staff have like taken notes on for verbal written comment for every meeting that the board has had from the very beginning. Our first meeting was April 2024. Because we don't want that input to be lost, and we really want to capture how generous the public has been with us, with their time, with their energy, with their thoughts, with their suggestions, and also try to capture some of the ways that that public input has shaped even, early in our process, what the board was voting on and the approach the board was taking to this work.
And
So,
I just want to give Michelle very quickly kudos because she took on this heavy lift of digging through all of this data and getting it in a way that we could include it in the report, that we could share with you all, and that we kind of have a system going forward to continue to track the community engagement. So thank you, Michelle.
thanks, Amy. And on that note, thanks for mentioning that. So this draft that you all have as part of your meeting materials goes through April, and that's not where it's going to end. It's going to go through August because our report is due in September. So it will be updated through August with all public comment to all board meetings and committee meetings. So basically, this is kind of the intro. It talks about how one of the first things the board did was ask Amy and I, as the public input board members, board seats, and as the co-chairs of the soon-to-be created Community Engagement and Communications Committee, to give the board a training on public engagement best practices in public policy development. So that was July. So that was within the first couple of months. And I really was encouraged by the support and the commitment that the entire board expressed to centering community engagement in our work. I also really appreciate the way that staff was able to work within our budget to secure contracts and manage contracts, which I know is an ongoing task. So thank you, Isabel. Thank you, Mimi. Thank you, Lee, to make sure that there is Spanish translation and interpretation for all of our meetings. That was started with the very first Community Engagement and Communications Committee meeting, and it continues to the present. And I think that even with our limited budget, and even though we acknowledge that there are more languages and we don't have, there are more accessibility things that we want to expand in the future. I'm really proud of this committee and grateful to the staff for prioritizing that from the get-go. And I think that that's really helped to foster, better feedback and more feedback. There's also in here a description of the stakeholder engagement process, in addition to the summary of public comment. So you all know a lot about the stakeholder engagement process, the focus groups from March and April. So I won't spend time on that unless you have questions. But you will see if we can go down to the next section on the volume and nature of public comment. So we received 384 comments across 108 meetings between April 2024 and April 2026. So across a 2-year period. About 2/3 were written and 1/3 was verbal. And in addition, there were some larger sign-on letters that had more than 1,300 signatories. there's a breakdown of like, how many board meetings, how many committee meetings, how much comment was at the board, how much comment was at the committee level, and that sort of analysis for people who want to dig into the details. You will see some things highlighted in this draft because those are numbers that need to be updated when we do the final numbers in August, right? So this won't say between April 2024 and April 2026. It'll say between April 2024 and August 2026. So that's why that's highlighted, and you'll see a few other places. One of the trends I found really encouraging, and it was great to just kind of see qualitatively as well, and to capture it for the future, is that participation really grew steadily the longer the board met, the more committees that we stood up. So, at the beginning, there was just a trickle of our BFFs that had been following, the bill that created the board, and we're really excited about it. But as we moved forward, we started hearing from people who, were new to the process, kind of widening the circle of public engagement, widening the circle of perspectives that we were hearing. So that was really exciting to me. If you could scroll down a little more. Here is a table for folks who like tables. So I think it's just a helpful quick visual that again lays out kind of what the public comment top line numbers and patterns have been over time. And then it talks a little bit about the various places where people were able to engage with the board. You'll see that the transition committee section is highlighted because when I did this draft in late March, early April, the transition committee was just getting started. So that will be added as well. Good, scroll down, thank you. Here you can see it separated out across the board and committees. And again, those transition committee numbers will be updated. There's lines for year 1 and year 2 for transition committee, of course, because that committee didn't exist in year 1 or year 2. And then there's some themes. So initially, a lot of the themes kind of evolved over time. So initially, we got a lot of public comment about how the board was doing its work, about public meeting law, those types of things. And then as we got going in the work and the committees were stood up, we started getting comments that were more about the actual what's in the plan, how it's funded, recommendations, kind of like, we like this, we don't like that, that sort of nitty-gritty feedback. But governance and accountability continue to be a strong theme throughout. Clearly when we're talking about public money and a public program that's intended to serve all Oregonians, this is something that is top of mind for folks, and I think that makes a lot of sense. And so I think that honoring public trust with transparency and doing the most diligent, thoughtful, thorough work that we can is really important to address this governance and accountability piece. We'll really care about the process, how things get done, as much as the outcome, like what results from that work. We did get a lot of general support, which was great. We got the third theme that we got the most comments on, which shocks nobody, was about the finance and the funding component. And then it goes on from there. So I think when I look at the board's adopted values and principles, I see them really reflected in what was rising to the top as most important in sustained engagement from the public throughout. So, community sense of ownership, making sure that we are reducing financial hardship. These are the types of things that we're seeing in the feedback. So that is also, I really liked to see that alignment. That was encouraging. I'm going to pause before we scroll down and just see, because I know I'm throwing a lot at y'all. Any questions or comments on what we walked through thus far? All right, we'll keep going. So there's a little bit of narrative description of each of these themes below the table. And then there's a note on opposition. So we did have folks who were opposed to our work from the very first meeting. I think some of our very first public comments and emails were expressing concern and opposition. And so, I did want to make sure that we were transparently capturing that as well. The opposition was a little shy about showing up in public meetings, I think. So a lot of that showed up as like emails to the board directly and some of those types of communications early in the process. But I think that the positive comments and the constructive feedback really outweighed the kind of like opposition to the entire concept and the entire project. But it's also important to acknowledge and recognize that that is some of the public feedback that we got. And then we tried to go back and capture, I'm really kicking myself. I should have been tracking this from day one, but there were some really important moments where public comment shaped what the board chose to do. So I tried to capture some of those instances. And if you all know of other instances, and I'm also soliciting examples from fellow board members, I'd like to capture more of those things. I know I'm missing some, but one was we had created a subcommittee. Amy was on that subcommittee of the board that was working on our values and principles. And we had brought our draft, we I think met 5 or 6 times. And we were bringing a draft to the full board for adoption. And at that meeting, we had a public comment that was making some really strong recommendations about how to make it more plain language and easier for the public to read and understand. And so we tabled the vote and we went back and we used that public comment to revise our values and principles, and we brought them back revised based on that public comment and adopted them later. So it's kind of those types of examples that I really wanted to capture and share back to the public to kind of close that feedback loop. Another one is the Medicare Part B credit, where we were hearing a lot of concern and questions. I think also, Colin, I'm sure you'll remember, and Amy and Mimi and folks who were at the town halls, this is something I know I got questions about, was the Medicare Part B component. And, the concern that retirees could end up paying kind of double into the proposed funding structure. And so, there was a robust discussion at the board and an adoption of an initial draft proposal where the universal health plan itself would pay Part B premiums for Medicare recipients to resolve that concern. So anyway, I won't read through all of them, but I think there's some really great examples of how public comment directly shaped the work of the board to date. The meeting time of this committee is another one. So you can keep going a little bit farther. Is that the end of the document? Oh, great. And then this section, it came directly from conversations that we have had here at CECC with all of you. So you will recognize the suggestions and some of the models that were put forward. So this is where I would also really welcome and invite any feedback that you all have on how to, maybe strengthen these sections if there are pieces that you think might be missing. So we talk about a public survey, a statistically valid statewide survey to get, a real understanding of public attitudes, especially from people who maybe haven't heard about the board or wouldn't necessarily come to one of these meetings to give testimony, but might have thoughts if they were surveyed. We want to hear from folks who aren't kind of self-selecting to engage with us, because we know that that's biasing the sample a little bit. So trying to find ways to break outside of that. Civic assemblies, we've talked about this a lot here at CECC. This is Mickey Durding's suggestion and a great model, and aligned with some of the models that Dr. Chi was suggesting, I think at the very beginning, starting that first summer in 2024. So excited to have that concrete recommendation. And then, of course, we've been talking for 2.5 years about the fact that this can't roll out without a broad public-facing statewide listening session and public education campaign that is like professionally run and fully funded. And it reaches Eastern Oregon and Western Oregon and Northern Oregon and Southern Oregon and rural and urban and in multiple languages and with ASL and, all of those types of things. So that is a strong recommendation that we are including as well. And then is this, oh, and then there's a little bit of discussion about, we have some frequent, what I lovingly and with lots of appreciation call frequent flyers, people who have really committed to following the board's work and engaging with us in a sustained way. And that takes a lot of time and a lot of energy. And they're doing it as volunteers as well. And so we wanted to capture that, that investment from Oregonians, and then also be really clear with the legislature about how many unique members of the public we heard from, and kind of separate that out from our frequent flyers who we hear from like sometimes on a monthly basis or multiple times a month, which is incredible. So there's a little bit of a breakdown on that. There's a little bit of a breakdown on, how many public comments we received at any given time. So that's really interesting. Year one, we had 60 comments total because we were just getting started. We didn't need a full 12 months. People were just hearing about us. Year two, when we started getting into the committee work and the nitty gritty of plan formulation and, what's covered, how we're funding it, it jumped to 246. So that's a pretty incredible jump. I was really impressed by that. And then year three, as we are doing some more wrap up and engagement and doing less plan formulation, it's dropping back down a little bit. And then we can keep going. And this is the themes broken out by year. So really, this is written for data nerds everywhere. I really hope that like my 3 best friends in Oregon read this, wherever they are, whoever they are. Public comment data nerds unite. We can keep going here. And then these are folks who were kind of the frequent flyers. So you can really see the commitment here from some of these folks. 42 public comments. Thank you, Lou. It wouldn't be a board meeting without you. So I think this is also just kind of helpful for us to contextualize who we're hearing from on what and when, right? What years they were active with us. We can keep going. And then this talks a little bit about what I covered at the beginning, right? Where this data came from, how it was captured. There is a limitation in that, I was not able to go back and listen to every meeting and listen to the public comment from every meeting and make sure that we captured it all. I was working from the board meeting minutes, which includes a summary of the topics, the main topics that each person raised. So that is a limitation. There's some really rich data. And I think to make it in a digestible form, and also to be able to, there was a limitation of my time and capacity to go back and do that. And then even if I did, I think it'd be so rich, I would have to kind of simplify it again to even put it in a report. So I want to acknowledge some limitations there. So curious if folks have any thoughts, suggestions. Thanks, y'all, for helping to shape this work and especially the recommendations. Colin.
Yeah, cool. Thanks for it was nice to look at this last month and then also honestly scroll together and just like reread it. So I appreciate this like that format. I had a couple questions. Good to hear that the stuff that's coming through August is going to be included um in the September report. Michelle, it's funny to have you like raise your hand and say like that you love tables, and I don't like, I feel really ambivalent about tables, but I really love this table. And I would love this table to like continue. I think it's really helpful to keep gathering this exact like framework for the communications data. And so I'm curious if there's like the ability for after September to continue those key phrases and keep the uh, figuring out the quantity of different comments on different things to be delivered in December. And then, I mean, like fingers crossed that could go forward like past into at least through, July 2027. So is that something you guys have talked about or I guess we're talking about it now?
It's a great question, Colin. And it's tough because this is something that board members have done on a volunteer basis. We're out of consultant funding. We're running kind of bare bones at this point, and staff is carrying a ton of work. So I would be happy to put together like a how-to document for the board member that takes over from, takes my seat in October. But I don't know, I can't volunteer them as a volunteer board member. I can't guarantee that this would continue after September. But I could certainly create a Cliff Notes version of how to add to it and maintain it. For sure.
I think that's cool. Yeah, that would be good to have at least, right? And then whoever can like choose to, yeah, have knowledge is power, so that the how-to guide would be cool. A similar question is kind of a clarification about how our public meeting laws work, because this is only tracking all the publicly submitted comments, which we've all, or I've seen, and I believe that we've mostly been tracking that those public comments are like, steering the direction of the board like a giant rudder over the years. And so that's been cool to see. My question, I guess, is about the public meeting laws and all of your like private DCBS emails. Like, is it true that those are also available to the public in some capacity? And if that's not true, no big deal. But if it is, then it could be possible to also expand this sort of data collection to sort of track the amount of like, there's a lot of opposition that came in through those private emails. It'd be interesting to see like the quantity of that just to know. Is that a possibility or is that sort of not really possible?
It's a great question. I would say I have received, aside from some of there's like one person that was a kind of a frequent flyer opposition figure in year one. He has submitted some public comments where he's just very concerned, I think, about publicly voicing opposition to a board that supports it, right? Which makes sense. It's a vulnerable experience, right? To speak out against people in governor appointed positions, they, might feel like, oh, am I going to be retaliated against in some way? Or, people going to get mad at me or whatever. So I respect that privacy. And so there have been some public comments, they are captured here. And I think that the private emails that were coming, they were mostly coming initially our DCBS emails weren't public at the time, I don't think. So they were going to the board's executive director, Morgan, at the time, and with the request to share them with the board. And those are not public. They weren't communications that were intended to be public, right? He could have submitted public comment. He chose to send an email instead. So I think I would never pull that out and include it in a report like this. I think that would, in my mind, that would be a little bit disrespectful. And then aside from that, most suggestions that I have received that's come through my email has been through public comment. And it's not a primary way that I've received suggestions is through my DCBS email. So I think the volume would be fairly small. And the times that people have chosen that communication method, there was a reason that they chose not to put it in the public record. And so I would respect that. Now, certainly, there's public records requests can be made. So that is a process under federal and state law. But I think that's a different process and meant for other things. So hopefully that answers your question.
Yeah, I think so. It sounds like there's if somebody thought this was important, which I don't actually know if it is, it could be possible to do a records request and then that that potential table could exist. Is there? Cool, good to know. I don't think that that's necessary, but I'm curious if what anyone else thinks about it. So.
Yeah, other thoughts? Thanks, Colin. All right. If you have comments or have feedback, especially any edits, please feel free to send those along to the board email and then I can work to incorporate them. Thanks, y'all. I'll pass it back over to Amy.
Great. And I think now is our time. If any of you committee members have updates about things you're working on, involved in, want to bring attention to in the realm of the work we're all doing, now's the time to raise your hand. Yes, Colin.
Hello. Yeah. So if people don't know on this call, I work part-time with Healthcare for All Oregon, a nonprofit focused on universal healthcare. So super excited to be on this committee, but my part-time day job is also working on this issue. And we've got a lot of stuff happening, right? Because this is important. So there's a few things that I wrote on a piece of paper that I want to find. So we've started a petition, a soft in collaboration with the Portland Democratic Socialists of America. And just for clarification for the recording and for people listening, like HCAO is a 501c3, so we can never endorse a candidate. So there's some nuance with like us doing any event in collaboration with the DSA, but they've stepped up with an interest in this issue. So there's sort of two DSA connected things that are happening over the next couple months. One is this petition, which is available on our website, which basically outlines what's been happening, and just sort of meaning all of the work that you guys have put into this huge effort, and then just trying to outline the reality that there's no guarantee that our legislators will take it up. We'll make it a priority in the 2027 session. So that petition exists at hcao.org, and we're going to be plugging it for the next 5 months until the 2027 session starts. So that's sort of one big effort. Another one is a series of people have been calling it whistle stop tours or town halls, coordinated with a member or two of the DSA in different parts of the states. So the push that we did in April for the governance board and HCAO town halls, we're not going to try to replicate that. It'll be after your September report is submitted. But in the last 2 weeks of September, from the week of the 14th and the 21st, we're going to try to do 4 events in Eastern Oregon, 4 or 5, and 4 or 5 events on the coast. So sort of a shorter, different kind of thing, and also trying to be clear about who the DSA is and who HCAO is, because they are different. Even though we're in red, we're not the same organization. But anyway, so that's happening on both the coast and Eastern Oregon late in September. And yeah, that's it.
Thanks, Colin.
Yeah. Any other updates from any of our committee members? Y'all are quiet today. So I think it's actually right now time for a 9-minute break now, before our public comment begins at 5. So if y'all can take a quick break and be back at 5, we'll begin our public comment then. Please either turn your camera on or indicate in the chat that you're back so that we know that we're all here for public comment. All right, it's 5 o'clock. See a few folks are indicating they're back. And Isabel, how many folks do we have giving oral comment today? Excuse me.
I had 8 people signed up and I see 6 of them here at this moment, but we might get some more over the next couple of minutes. So we'll see. Between 6 and 8.
All right. Well, I think we should probably go ahead and get started for the ones that are here. If you want to go ahead and lead us through calling the public comment folks up.
Absolutely. So as always, really appreciate the people that give public comment. As Michelle's hard work and report highlighted earlier, it is really valued and taken into consideration. As a reminder, for written public comment submissions, those are due 72 hours in advance of the meeting so that I have time to get those ready and people have time to review. And for oral public comment, like we're about to do now, those signups are due 24 hours in advance of the meeting. Both of those can be done via our website. And for most of the time, it's 2 minutes per person. But today, because we have a longer hour for public comment, we have 5 minutes per person. So first up will be Lou Sininger. You should be able to unmute and share your comment whenever you're ready, Lou.
I should be on here pretty soon. Oh, well. Oh. There we go.
We are
Hi. Good work, guys. Well, we're getting down close to it, right? So it's very important that we get feedback into the governance board and hopefully our petition works, HCO's petition, to energize the legislators to build an absolute universal healthcare plan around the governance board's recommendations. I did want to talk a bit about, again, unions. Now there's the Taft-Hartley unions, or otherwise known as multi-employer unions. There's been, to my mind, I don't know that you've got a lot of feedback concerning those unions. Now, these are the, carpenters, construction workers, all that. They have their employer labor management committees that actually build, besides retirement, health plans for their workers. So if you're a worker in a union, you sign up with the employer, that union negotiates with that employer, and sometimes multi-employers. So what they do, it's really, in this day and age, it's really an example of a single payer plan. So what they do, they negotiate, and many of them are able to negotiate that even when these workers are laid off, they still are covered through their health insurance plan that applies to all of them. So if we build a universal plan, recognition and adaption has to be figured out for these unions and their membership. For instance, UFCW negotiates with a number of grocers, but their union also covers parts of Washington. So does the plan that they negotiate for. Our plan, the universal plan, would be much better for them, but what's going to happen to those members that are in Washington, right? Another employer is the Teamsters. Now, the Teamsters have a nationwide plan with Blue Cross Blue Shield. How are they going to be treated what will they think if the universal plan steps in? They will lose everybody in Oregon that they have signed up for their plan. You have to take that into consideration. They will lose that. Every time they lose a chunk of membership, they lose power to negotiate, right? So I believe that a committee should be formed to get input and concerns from these unions, because it's very important. It's very important, not only for the membership and their continued health, but also how the universal plan will be received in Oregon. So I'd be happy to answer any questions, but it is a concern of mine. Public employer unions, the nurses union, all those unions, and the teachers union, all those unions are very much behind and understand the savings that they would have with a universal plan. However, like I said, the Taft-Hartley unions are also known as the multi-employer unions, have some real concerns. So I thank you for your attention and giving me this opportunity to speak. This is my new kitty.
Aw. Thanks, Lou and Kitty.
Yeah.
Thank you.
She usually sits on my shoulder.
Oh,
Hope we get to see that.
Yeah. Oops, she's shy.
Well, thank you, Lou.
You bet.
Next up, we have Karen Baker. And Karen, she's got 2 clicks, and then you should be able to share your comment now.
Horrible picture. Okay. First, I'd like to thank the Governance Board and the Community Engagement Committee for all your work over the past several years. I followed it semi-closely, and I just know how much work everybody has put into this. I've been an activist for universal health care for almost 15 years, and I've been a believer in single payer as the most effective and efficient way of getting there for even longer than that. I've been fortunate enough to have really good employer-paid health insurance for most of my life, but I was able to retire early when I was still in my mid-50s. And for the first 5 years, things were great. We had an enhanced subsidy, and we were paying a reasonable amount, a couple of $100 a month for myself and my husband. But as probably everybody on here knows, those enhanced subsidies expired at the end of last year. And so our premiums went up over 1,000%, from $200 a month to almost $2,000 a month. And that's unsustainable. I just feel like I have to hang on another year and a half before I get Social Security. So I feel like it's way past time for our country and our state to not provide affordable health care to all of its people. I would like to see Oregon to be the first state to have universal health care. Like in Canada, Saskatchewan was the first one. We can be the first one. And with a guarantee that people won't pay more than 10% of their income for full coverage, including no additional premiums, co-payments, or deductibles. That $2,000 I pay now a month, I wouldn't mind paying that if that's all I paid. But that is nothing. That's just a guarantee that probably won't go bankrupt, but everything else is out of pocket until you hit that, I think it's $9,700 deductible. I do believe that the wealthy should pay a higher percentage of their income, more than the middle class, to fund this plan, because they could afford to. And I support tools like progressive taxation to help achieve this outcome. Higher income earners should pay a higher tax percentage. Oregonians deserve the most affordable plan and an excellent benefits package with the most comprehensive coverage possible, including dental, orthodontia, vision, mental health care, gender affirming care, and naturopathic care. We need a healthcare system that prioritizes people over profits. Thank you.
thanks, Karen.
And next up, I have Robin Gottlieb. And apologies if I did not pronounce your name correctly. Please correct me, and you should be able to unmute and share your comment now.
Hi, you did pronounce it correctly, which is rare. So great job. Hi, my name is Robin Gottlieb. I'm a community organizer. Thank you so much for letting me speak today. The healthcare situation in this country is dire and it's only getting worse. That's why the Governance Board's Universal Healthcare Plan for Oregon is more important than ever. Oregonians need no or low-cost comprehensive health care that includes dental and orthodontia, vision, mental health care, gender-affirming care, and naturopathic coverage. The level of income inequality in this country is also dire. The wealth gap only continues to widen, which is why it is critical that the wealthy pay a larger percentage of their income for this plan than the middle class. This is how universal programs are funded in other countries where they have a huge success rate. This statewide universal health care plan will be especially beneficial for union members. Healthcare negotiations take up a huge portion of time and money at the bargaining table. Removing healthcare from contract negotiations will be a boon to both union workers and their employers. Labor union support will be critical for the passage of this plan. Please make union outreach a priority. Thank you for all your work on this important life-changing healthcare plan and for providing the opportunity to testify today.
Thanks, Robin.
Thank you, Robin. And next up, we have Tom Sinsick. You should be able to unmute and share your comment now.
Okay, I'm ready to get started. Tom Sinsick, retired family nurse practitioner. Again, so much gratitude for all of your work. I've been at this since I ran for office on this item in 2014, door to door, knocking 13,000 doors in our district here. And the opportunity to kind of go on a little bit is very much appreciated. You might think about going forward to give time at the beginning and at the end because of people's, I know you're trying to be as open as possible to the opportunity to have a longer meeting. Maybe some people could come on earlier, not that specific agenda related item, but just an opportunity for an exchange. And I would think that perhaps that when somebody brings up something, it could be a hair bit more interactive if needed, like you need a clarification on something that somebody has said. I think that would be a good idea. And so in particular, the good news is for all the work that you're doing, which is so important and will be important all the way in through the legislative session and hopefully beyond, we will need to continue to engage communities all the way. That this is the most important work in general to get us to where we need to go. While the financing is being figured out, we know now that this is just a matter of political will. It's not a matter of should this or shouldn't this happen. And the Oregon voters are ready for this. They've got a constitutional amendment that they've passed. And so it's just a matter of getting the best opportunity from the you and the governance board to put forward information to build the legislation that's needed, and the advocates can go to work and make sure it's in line with the vision that's been created in ORS 751. And so those are the good parts about what you're doing. If there are gaps in the community engagement process that's happened because of the so-called funding problem, that should be brought out maybe in this meeting. Maybe I just got on, so maybe you talked about that at the beginning. There is opportunity if you're willing to get more money from the legislature. It's just a matter of doing the ask. And we're not talking about for the future. We're talking about for the needs going forward, where there's been a message that there's not enough money. The legislature does have a September session where if you don't ask, you don't get. And to figure out what might the communications committee need going forward, what would the financing piece, the actuarial economics piece need to going forward, what kind of further analysis to get the best information forward to everyone. So I continue to, and I'm thanking Amy and Michelle I'm not sure. I think Amy's going off first. Might have got that right. I want to thank you for your work. And maybe I got it wrong. Maybe it's Michelle coming on. But we want to thank you. We're looking forward to new committee members coming on. I think that's kind of it. But keep in mind, while the community input is important, it is really just a matter now at this point of political will in the legislature to do what they've been called on to do by the voters of Oregon to make access to universal, publicly funded, affordable healthcare a reality for Oregon. Thank you very much for the extra time.
Thanks, Tom.
Thank you, Tom. And next up, we have Lori Hoagland. You should be able to unmute and share your comment now.
Hi, I'm Lori Hoagland, and I wanted to take a moment to talk about public education for the Universal Health Plan. I was part of the operations committee. I'm a nurse practitioner, and I've been talking to various groups of people for years on this matter. And a couple of things that I feel are really important that I've learned are that the patient experience is personal in our country. Sometimes people are private about their medical experiences, and they often don't have the opportunity to understand that some of the struggles they are in are kind of baked into a healthcare system of inequality, and one that accepts that some lives are dispensable. And I think as we have more community conversations and opportunity for people to see what's possible, and I would say in this regard, it's good to highlight what we're already doing. I worked on a community health van with a clinic, and was able to go to migrant camps and to homeless shelters, and we are doing some things very well, and people need to be aware of that because sometimes there's so much despair around healthcare that they don't realize that we can actually do good things here. The second point is that a lot of systemic problems are experienced by many, many patients, and they don't realize that it's a system. They may think that it's just their bad luck, or perhaps the hospital where they went to get care. But the truth is that there's a lot of consistencies that we need to bring out and talk about, things like formulary choices and what's in network, what isn't in network, ghost providers. So when people go to find a psychologist on their insurance website, they may or may not be taking that insurance anymore. And people are frustrated, but they don't see number one, that is a systemic problem, and that if we change the system, these problems will change as well. And probably I'm guessing with the simplicity of one universal system, a lot of them will go away. So I think that I guess my point is to continue not just with focus groups, but the community conversations are extremely important so people can connect dots as we move into this next phase of having universal healthcare become a reality. And the last point I wanted to make is media coverage. Recently, I sponsored a town hall with HCAO in Southern Oregon, and the TV news reporter, when I was listening later, totally misrepresented the event, misrepresented universal care, and made it come across as though the whole point of our conversation at the time was OHP coverage. And I think it's really important that as we are trying to get this information out to the public, that we're proactive in spending extra time educating TV, radio, and news journalists so that they are articulate and accurate with how they speak of the Universal Health Plan. And that's basically what I wanted to say. Thank you.
Thanks, Lori.
Thank you, Lori. And next up, we have Bruce Deloria. You should be able to unmute and share your comment now.
Okay, you should be able to see me and hear me. Hi, everyone. Thank you, Community Engagement Committee, for all the work you do. My name is Bruce DeLoria, and I'm an Oregon resident and retired computer systems specialist, though I still maintain websites and write programs and do all that stuff. I've been following the development of the Universal Health Plan, and I'm here to speak about the software called an electronic health record system. A system that will be needed for the health plan, and I understand that there's discussions going on about that. I would like to urge the board to adopt a buy, don't build approach for the core software that will track enrollees, claims, and cares. And the particular one I would like them to adopt is Epic. It's called Epic, and Epic Connected Solutions, the foundation of that system. Roughly 70% of Oregon hospitals already run on Epic, including OHSU, the Oregon Clinic, and many Providence-affiliated providers, with more rural hospitals joining to gain interoperability. Most Oregon clinical data already lives in Epic, and many patients already use Epic's MyChart portal. Independent analysis show that building a custom from scratch EHR, that is electronic health record system, is a multi-year, seven-figure at least commitment with ongoing compliance burdens that never end. By contrast, buying a certified platform like Epic provides tested workflows, integrations, and federal compliance out of the box. Therefore, I strongly recommend that the Universal Health Plan not hire an entire company of programmers to write new software from scratch. That would take a very long time to reinvent that wheel. That approach is expensive, slow, and risky for a statewide plan that must work on day one. Instead, I recommend adopting Epic as the core system of record for enrollee data, claims, and care. 2, if possible, negotiate access to the underlying source code or full configuration rights so Oregon can deeply tailor the system. And 3, hire as few as one very capable programmer, perhaps a senior engineer experienced with Epic and healthcare interoperability, to configure and refine the system over time. Build UHP specific tools on top via this is a technical term, FHIR smart, and maintain the system as needs evolve. We are going to have a staff anyhow over time, keeping the system in line with other systems, accounting for changes and upgrades. So we want to have a staff, but let's start with a system that's already built and look at it as a maintenance and improvement staff. This single programmer could be retained on an ongoing basis because the staff will require continuous adjustments, and that is far more efficient than funding a large temporary build team and inheriting a fragile custom system. In short, Oregon does not need to reinvent the wheel. By choosing to buy Epic, avoid a large custom build team, and retain one strong programmer at least to configure and maintain the system, the Universal Health Plan can reduce risk, control costs, and deliver a more integrated, patient-centered system for all Oregonians. Are there any questions about what I'm bringing to the table? I know you'll probably be bringing this to the rest of the of the governance board. I want to quickly include a disclaimer so it's very clear that I have no financial interest in Epic Systems Corporation or any other electronic health record vendor. I do not receive compensation, consulting fees, or other benefits from Epic or any healthcare software company. Although I am an experienced programmer and system analyst, I have never worked in the medical software business and do not claim specialized expertise in healthcare, IT procurement, or implementation. The recommendations offered in my testimony are based on publicly available information, general software engineering principles, and my perspective as an Oregon resident and taxpayer. They are provided solely for informational purposes and should not be construed as professional advice on healthcare technology, legal, or financial matters. And aside from that, most of my career was in Washington State. I worked for Puget Power as a system developer, analyst, and operations, on-site operations director. And then I worked for the state of Washington. I worked for the Department of Information Services. And before that, I worked for the Emergency Management Division as the lead for 3 buildings, 121 PCs and 3 servers, and those were the fun 90s. But yeah, after basically I moved down here just before retirement and just worked for a short time with the BLM. But this is just common sense amongst programmers, especially with complex systems. So I hope this is accepted, and if there's any accepted recommendation as a recommendation, and if there's any questions, I welcome anybody to get in contact with me, and please include me if you have a need for a committee, a search committee or something. Thank you very much for the opportunity.
Thank you.
Thank you, Bruce. I'm sorry. Go ahead.
We were on the same page, saying the same thing.
Okay.
Thank you, Bruce, for sharing your comments. And it doesn't look like any of the 2 other people that signed up have joined. So I think that is all of the public comment I have today. Tom, I see Tom's hand up.
But yeah, he already spoke.
I did just want to share with everyone listening that Amy and I are really committed not only to listening to these public comments here at CECC with all of our fellow committee members, but we take these public comments, summarize them, and bring them to the next full board meeting. So part of the purpose of this time outside of work hours is to create a more accessible opportunity for public comment. So your comments don't stop with us. They go on to the full board and we bring those forward. So I did just want to reassure folks that is part of the process.
And also just a reminder, we, under the current public meeting, we can't really respond or engage. We just are able to listen to you. So we're not being rude. Thank you. But we are hearing you. Colin.
Yeah, Tom and I are friends, and he sent me a text earlier sort of requesting if Isabel could read the names of the last 2 people, just in like, if that's possible. For example, like if that phone number is the person who wants to speak or sign up to speak.
Sure. The 2 people that did not, that I don't see today are Suzanne Steffen and Patrick Leshock.
Yeah, so if either of you are the 503 number ending in 1538, now's your time. Or
Also, if you are on the phone and trying to speak, unmuting often isn't enough. You have to hit *6 to unmute if you're on Zoom on the phone. Is that correct?
Well,
sounds right.
And unless no members of the public have the ability to unmute in these meetings.
Oh,
that's true. So if they're anonymous on the phone, there's actually no way to know if they're the public comment.
Yeah, if they could raise their hand.
Okay. Hearing nobody claiming that they are one of those two people. I think our last item today is just reflections on today's meeting and thoughts about meeting topics for our August community engagement and communication meeting. Michelle.
I do just want to say, if the person on the phone is trying to figure out how to raise their hand on the phone, I just want to make sure that they know that it is *9 to raise your hand if you were just dialed in on the phone. So I didn't want somebody like trying to figure out how to indicate
Thank you, Michelle.
that they had signed up for public comment. So anyway, sorry, go ahead.
No, that's great. Thank you. Appreciate that. So yes, Craig.
Hello, thank you. Hey, I guess this is the time. There's nothing real important. I just made some notes during the meeting. I wanted to tell Colin I signed the HCAO petition. Number two, I was very impressed with the public turnout. I love to hear from people, and there was a lot of people. I thought that was very impressive. And I do listen. I learned something from Karen. I didn't know about the Canadian healthcare system. I thought it was introduced all at once in all the provinces, but she was correct. I looked it up, Googled it, and one province started it, and then it spread throughout. I just found that interesting. And I listened to Bruce, and Bruce made some good points about that computer system or program he was talking about, because I'm sure we all remember how when the when the Affordable Care Act rolled out, and we had the state of Oregon attempted to build its own website, database, whatever. And I remember they hired Oracle, and it was a big fiasco, and it didn't work. But anyway, I thought that was interesting, the comments that Bruce made. Thank you for listening to me.
Thanks, Craig. Other committee members have reflections or ideas for our August meeting or future meetings? Yeah, Colin.
Yeah, Tom isn't texting me this particular thing I'm about to say, but I also am curious about this and maybe what's his hand is. But yeah, sorry, Tom, that was your 5 minutes. I wish there was a different platform for this kind of dialogue. But he brought up like the point that there is some ability for the governance board to ask for more money for something in the September legislative days, I guess. And may we encourage you to do that, to try to get more money for even like the things that are on our suggested list from our focus groups, or like the final pages of the report that we walked through together, like a survey. There's been lots of talks about a new survey, because that most recent survey from Warren George is over 5 years old. And yeah, or other like a different educational approach, I think would be really beneficial. And what's that? A closed mouth doesn't get fed. Like if you don't ask for it, you're definitely not going to get it. So yeah, how do we do that?
We can certainly, yeah, I hear you, Colin. This is something we've discussed at the board level as well. We are diligently working through all of the processes that we are obligated to work through as a board that is governor appointed within the state of Oregon, which includes going through specific channels and processes. And we are working with our legislative champions through our chair and our executive director, and also through the DCBS process because our budget is part of the DCBS budget. So like Michelle Glass as a board member, if I showed up and like testified at September legislative days and said, fund the board, please, that it would cause more problems than it would help, for sure. Advocates can do whatever they want, but we are diligently exploring all of the options to fully resource this work, and I hear your request and your recommendation.
Yep, to just keep on trucking, I'm curious if other people on this community engagement committee would like to encourage Michelle, Amy, Mimi, Isabel to try to do that. Does that seem good to y'all?
And I think I think like Michelle said, we already have a plan where we're doing that, and we're using the channels that we have to use, which is working through DCBS and Mimi and our board chair being the main contacts with the legislature. And yeah, so that's all in place, but we hear your encouragement.
And yeah, you're certainly welcome to encourage. I think my point is we're not leaving any options on the table. There's nothing that we're sitting back and like saying, we're not going to do that, right? We are fully pursuing all
Yes.
options. So I do want to reassure you that even if you don't see Amy and I writing testimony to the legislature in our official board capacity asking for additional funding, that that is because in order to protect this work, we have to follow the process, and we are. Like there is no option that we are not pursuing fully. So yeah, just want to reassure you.
Thank you. I'd like to just keep asking more questions about it because I don't, I don't even know what I don't know, right? So are you guys able to articulate Mimi, are you putting forward like a specific ask, or I'm sure you will, but are you able to articulate to us like this early what that would look like, or is that like at a later date you'll have that more clarified?
So, I think one of the things about public meeting laws is having things on an agenda that are that we let the public know ahead of time that we're going to discuss, and this really isn't on the agenda. So I'm just going to defer that for right now. Thank you.
That sounds good. Well, maybe let's my request we discuss it more in August, and that sounds probably likely. So
I also want to offer to anyone on the meeting that is something that was discussed, has been discussed at board meetings. I think at the July board meeting, if folks want to review the recording that's on the website, that is something that we discussed at the July board meeting, and it was on the agenda. So
Other reflections or thoughts about our August or future meeting topics? I'm trying to think timing wise, Michelle, since you're going to do the update for the number crunching for the public comments, I think for the August board meeting, and this is the week following, will we have that to share? Not to put you on the spot, but I was just kind of
put me on the
thinking
spot.
through.
I'm fair game. I think, yeah, aside from, of course, I will want to include the CECC public comment from the August meeting, and I won't have that yet. But I'll have everything up to that point. So I could certainly bring back a little update with some final numbers for the committee if that's something that folks are interested in. And then just add the CECC public comments after that when I finalize.
So the May through August meetings other than the CECC.
Yeah. And then I think, in my mind, the most important job of this committee right now is to listen to public comment. It was great to have, more members of the public here tonight to hear from. And so I think even if we don't have a lot of topics for committee business, certainly, we can get an update from the board and we can prioritize public comment. But I'm wondering if there's not a lot of other topics that the committee is prioritizing at this time. If we want to meet at like 4:30, so that we can, do some updates and then really the real purpose of the meeting would be that public comment, and then do committee member updates and meeting reflections after that, and just kind of make the meeting focused on the public comment a little bit more for this next phase of the work, like August and September at least, that's my last meeting. So curious how folks feel about that.
it's fine by me. Yeah.
So I think the proposal on the table is for the August and September meetings, doing a 4:30 start time, doing general board updates and any other CAC specific updates we have, and then going into public comment, and then ending with any updates you all have and what we're doing right now, reflections, next topics. Does that sound good? So public meeting time will stay at 5 p.m. Okay. Oh, I see a yes in the, or that might have been for something else. Sorry, Craig. I just saw your yes. So I don't know if it's for this
That's
or
all right.
something else. Okay, and I see that works for me. Okay.
Hey, since you're real quick, I know this is a technical thing and no one's going to care, but is it? The reason I was trying to avoid coming on camera. I don't have at the bottom of my screen other meetings I attend. I have reactions where I can give a thumbs up or I can clap. There's nothing here. I just have raise hand. I was trying to do something. I didn't have to bother you folks. I could just agree by doing, but I don't. Does everyone else? I've clicked on more. I don't have any type of reactions other than raise hand. Just curious.
Yeah, I think I can
I
share
need
that.
staff to answer that.
Yeah,
Thank you.
because this is a public meeting and it would be very hard for me to capture agreement and things like that that are expressed non-verbally during the meeting in the minutes. It would be very difficult for me to reflect that, and it's also not recorded in Zoom. So I would be having to sort of manually frame by frame go through the meeting and try and capture any. And actually, all of your only the speaker is recorded during the meeting, so I just wouldn't be able to reflect that in the minutes, which is why we don't have that function.
Oh, okay, that's all right. I just curious. All right, thank you.
Yeah, it's so tricky. Like we all want transparency and a public process, but the way it actually works is sometimes surprising and a little clunky. But yeah, thanks Isabel for making sure the process is clean and transparent for anyone who wants to check back on this meeting at any time in the future. So appreciate that work.
Any other final reflections or next meeting topic ideas before we adjourn for the evening? Yeah, Colin.
Oh, hi. Maybe like I'd be interested in trying to frame with like this group, the Brain Trust, the CAC, the Community Engagement Committee, like framing those our ideal scenario or like our ideal recommendation for like a little more specifics of like the survey, on that final page of those 8 pages that the draft that we walked through. It seems appropriate to me to use the Brain Trust here and outline a little more. Does that seem reasonable, or like say what we recommend as a group towards the board, or is that, yeah, what do you guys think about that?
I think we may have a timing issue. Do we with our August meeting and our deadlines?
So
I don't know. I'm asking Mimi and Michelle in terms of, you know,
yeah, in terms
the
of
report.
So yeah, I will say, Colin, that's been an agenda item since January. Like every meeting we've said, what's your recommendations for the report, right? Like that is where the recommendations in this draft came from, is that agenda item. If you look back, we had that agenda item in March, future planning. We had it in April. Like every time we've met this year, we've asked you all, like, what are your ideas? What do you think we should recommend? And that's also the purpose of bringing the draft tonight, was to say, like, I think I asked, like, what edits do you have? Anything that you would add? So I think that we've tried to do that when there was like timeline left to make substantive edits. And by the August meeting, we'll basically just have time to add the public comments from that meeting. And that's about it, because the report will be mostly drafted. So I don't know if there was like, I'm open to feedback if you feel like there was a process that could have been used better, but it has been like an actual standing agenda item all year where we've been asking you all, like, what you want to recommend for the next phase of public engagement and what to put in the report. So that was our intention, was to create that opportunity for that discussion starting earlier this year.
All right.
Craig?
Yeah, thank you. I got to thinking. When we were discussing asking for more money from the legislature to continue on, here's my question: are we supposed to? I should know the answer, but I don't. Are we? Is there a sunset date where our group's supposed to shut down, or are we going to continue on until this thing goes before the legislature? I'm just curious. Thank you.
Yeah, it's a great question, Craig. And so if by we, you mean the CECC, it's really up to, it's kind of dependent on a couple of things. Amy and my term ends in September. So there will be a new board member appointed in October. And then Amy's board term officially ends in January of next year. And there will be another board member that the legislature is appointing in September to replace Amy. So I don't actually know the answer. There is going to be a phase of the work where, just like now, we've kind of run out of, we've completed our work plan. We don't have consultant funding. So aside from getting y'all's feedback on the report draft and some of those recommendations and hearing public comment, there isn't a lot of work for the CECC to do in this phase until we can get some additional funding and capacity. And so there's like the board members themselves, the folks who are appointed in those public engagement seats. Because it's a fully volunteer position, Amy and I raised our hand and signed up. We were like, we want to co-chair this committee. It's really, why we joined the board. I don't know what the capacity of the folks who are going to replace us is going to be, and I don't know who those folks are yet. So I think that the timeline post-September is kind of to be determined to a certain extent. So while there's not like an official sunset date, there are some questions, I don't know, it may need to go on pause. If by we, you mean the board does not have a sunset date. And I want to make sure people know that really clearly. The legislative bill that created the board and the ORSs that Tom was referencing that govern the board are really clear that this board exists in perpetuity unless and until the legislature sunsets it in order to create the permanent body that would govern the plan, or they choose to sunset it because there's, that's a decision they can make about state boards at any point. But without action from the legislature, the board will continue to exist. And the committees kind of are just, they get created at strategic times to support where we're at in the work of the board. And then they get paused or sunsetted when there isn't work for that specific committee to do at that time, or there isn't capacity to support the meeting of that committee, which are often linked. So
Right.
that's a very long answer. Hopefully that answers your question.
Yeah, you did. I apologize. I didn't say committees. I meant the committee. I understand now. Thank you.
Yeah, it's a good question. Any other final thoughts, reflections, meeting topic ideas before we close for the evening? Okay. Oh, is someone about to say something?
I was gonna say great meeting. That was it. Good meeting.
Thank you. Thanks, Craig. Appreciate it. All right. Well, it was great to see you all this evening, and we will see you back here in August. Encourage you, if it's helpful for context, to watch board meetings in between these meetings. Maybe watch a transition committee meeting. I know some of you, a couple, or at least one of you was on the transition committee. Yeah, so thanks everyone, and we'll see you next month.
Thanks, y'all. Bye.
Bye.